Vanakkam. If you come across a hand injury, either a minor injury to the finger or a major injury to the hand, you need to do a dressing primarily after examination of the wound or before referring the patient to another center. If your patient has come to you with a sutured wound on the hand or a wound on the hand or an infection on the hand, again you may need to do a dressing. And when we say dressings, it is not just applying some gauze pieces, some pads and tying it around with a bandage. It is much more. To do a dressing comfortably, you need to have a basic dressing setup which is quite simple to get ready. In this video, we shall see exactly all these. How to get a dressing trolley ready and how to do a dressing on the hand or fingers. We shall learn about how to do dressings on the hand or fingers, but we shall learn about it in two parts. In the first part, we shall learn how to set up a basic dressing trolley so that the dressing can be done comfortably. And in the second part, we shall learn how to apply the dressing. To actually make the act of doing a dressing comfortable for both the surgeon and the patient, we need to have two basic items that we shall call the basics and 5 specific items that we shall call the specifics. The first basic requirement for doing a dressing is a dressing couch with a Macintosh sheet to prevent soiling of the bedspread. We must remember that no dressing on the hand or finger must be done with the patient sitting or standing. All patients must be made to lie down and made comfortable before the dressing is done. And the second basic requirement before doing a dressing is the biomedical waste disposal bags. We know the green for plastic and paper, yellow for soiled gauze, pads and bandages, red for used gloves and blue for needles and sharps. Having seen the two basic items required for doing dressings on the hand, we shall now see the specifics of the dressing trolley. The first, of course, is a trolley with 2 levels to arrange the materials. The second is chemicals. The third is trays containing instruments. 4 is linen materials, gauze, pad and bandages. And 5 are the accessories that will be needed for doing a dressing. First, we shall consider the trolley. As we have mentioned, it needs to have 2 levels. The lower level will contain the autoclaved linen materials and the upper level will contain the chemicals, the trays and the accessories needed for dressings. Along with this trolley, usually there will be a tray to hold the disposed materials which can then be disposed to the biomedical waste bags. The basic chemicals and solutions that we will require for a regular dressing are first a hand sanitizer, then normal saline solution, povidone iodine solution, hydrogen peroxide solution, surgical spirit, liquid paraffin which we use over grafted areas to keep them lubricated, turpentine oil which is used when there are maggots in chronic wounds, merbromin solution, and among the ointments, 2 basic ointments we generally use, a debriding ointment of papinuria and a povidone iodine ointment. Next come the trays that are going to contain the autoclaved instruments for use for the dressing. The size of the tray can differ with the load of dressings that need to be done, but it is ideal to use a single tray for a single patient to ensure sterility. A single tray needs to contain the following basic instruments. 1. A pair of mosquito curved artery forceps. 2nd, straight mosquito artery forceps. 3rd, iris scissors. 4. Suture removal scissors, and if necessary, a stapler pin remover. 5. A pair of toothed forceps. 6. A stainless steel cup for holding povidone iodine solution or saline, and this tray can be packed and kept ready for each patient. The linen that we are going to use for the dressings are of 3 categories: gauze pieces, pads and bandages. These should be autoclaved in containers and the size of the containers depends on the usage. There should be a separate container for gauze, pads and bandages. The accessory items that we will require for performing a dressing comfortably are a bandage cutting scissors, a sticking plaster roll, crepe bandages in various sizes ranging from 6 cm to 8 cm for the hand, and small finger bandages, sterile gloves for handling the wound, and examination gloves to take down or apply the dressings, and a tray to wash the wound in. Having made the arrangements for applying a dressing, we shall now see how the dressing is actually done. First, we shall see the basics of applying any dressing. A basic dressing consists of a primary dressing and a secondary dressing. The primary dressing is the part of the dressing that is in actual contact with the wound. It consists of a non-adherent layer and an absorbent layer. This non-adherent layer is a paraffin coated material that will not stick to the wound, and the second is the absorbent layer, which usually consists of gauze pieces that can absorb the exudate coming from the wound. This primary dressing is usually retained in its place by a secondary dressing, and this is usually a bandage. The dressing should be securely applied and snugly fitting. It should neither be too tight nor too loose. As far as dressings on the upper limb are concerned, there are two types of dressings. One are known as the minor dressings and the other are the major dressings. The minor dressings are those that you apply for just a single finger or two fingers, ideally done for injuries to the nail plate, nail avulsion injuries, injuries to the tip of the finger, or just skin lacerations on the finger. Now let us see how a minor dressing is applied. As I have said, a minor dressing is a dressing applied on the fingertip. Now let us assume that red mark that I have made is the wound on this volunteer's finger. First, after cleaning the wound, we apply a paraffin gauze over the wound, depending on the size of the wound. Instead of a paraffin gauze, a commercially available paraffin dressing, which is known as tully grass, can be applied. After this is applied, a gauze piece is taken and placed over this paraffin dressing. This is folded over the end of the finger and then brought around it, similar to what is done for a stump dressing. Holding the end of the gauze piece, a finger bandage, that is a finger elastocrepe bandage, which is made by cutting from an elastocrepe bandage to the size of 1 inch by 4 inches. This is placed over the end of the gauze piece, and again it is folded over the tip of the finger and then circumferentially it is wound around the finger. Just make sure that this elastocrepe bandage application is not too tight. The end of this elastocrepe bandage is secured with a small half-inch piece of plaster. This plaster must never go around the finger or be stuck on the skin of the finger. A major dressing is a dressing which is applied for the entire hand. This needs to be done even if there is an injury to a single finger, especially if there is a skin loss on the finger or a tendon injury on the finger or a fracture on a single finger. A major dressing needs to be applied if the injury involves more than 2 fingers, or an injury of the palm, injury of the dorsum of the hand, or injury of the forearm, elbow or arm. Before we go in to see how this major dressing is done on the hand, we shall emphasize on 3 important points to be remembered before doing the dressing. Point number 1. Keep the thumb separate from the dressing applied on the fingers. That is, the thumb must not be in the same plane of the fingers after the dressing. Second important point, we must place gauze pieces between the fingers in the finger webs before applying the pad over the fingers. And the third important point, after the dressing on the hand, the fingertips must be kept exposed. I shall demonstrate a complete dressing on the hand on this volunteer. The line that is marked on the palm represents the wound. First, after cleaning the wound, a paraffin gauze is applied here. This will ensure that there will be no pain when the dressing is being removed. Either such a paraffin gauze can be applied, or a commercially available paraffin dressing which is known as tully grass can be applied. The paraffin gauze can be prepared by soaking pieces of gauze in liquid paraffin and autoclaving them. The next to be applied is a gauze piece. Here a gauze piece is applied because it is a small wound. Depending on the size, either a gauze piece or a pad needs to be applied. This is the absorbent part of the dressing, which is going to absorb any soakage from this wound or exudate from this wound. In cases where you expect bleeding from the wound, instead of placing a single gauze piece, place multiple gauze pieces one over the other before applying a pad. This will ensure that the compression of the pad will be concentrated on the area of the wound and ensure hemostasis. Next, gauze pieces are placed between the fingers to ensure that there is no maceration of the skin in the finger webs. Now the pad is placed and made sure that the thumb is placed in a plane perpendicular to that of the fingers. This can be ensured by running the pad through the thumb web, and this will ensure that the thumb remains separate. Then the bandage is used to wrap up this dressing. This bandaging is the secondary dressing that is being applied to secure the primary dressing. After finishing the application of the bandage, avoid tying a knot. Instead, secure with a small piece of plaster and ensure that this plaster is just about an inch in length and does not go around the circumference of the hand. If the dressing is going to go and involve the fingers also, in case of injuries involving the fingers, the pad needs to go around the fingers too, and here it must be ensured that the tips of the fingers are kept exposed.